In the past 30 years, the number of obese children has risen dramatically across the United States. The statistics are nothing short of alarming. According to a recent study by the Centers for Disease Control and Prevention, more than 30% of U.S. school children are now obese. Since 1980, the percentage of 6 to 11-year-olds who are classified as obese has almost tripled. Overweight kids are now more vulnerable to disease that once were a rarity among children, including type 2 diabetes, hypertension, and breathing irregularities while sleeping. Overweight children and adolescents are also at a greater risk of developing heart disease, high cholesterol, and high blood pressure. This onslaught of obesity-related diseases also comes with dire financial consequences for our country. The CDC estimates that the cost of treating diseases linked to obesity grew by $23 billion between 1995 and 2003. In other words, it's clear that childhood obesity has become one of the most pressing challenges facing our nation. The question is, what are we going to do about it? Today we will examine how we can best combat the staggering obesity epidemic and improve the health and well-being and the success of our school children. While today's hearing will focus primarily on how we can increase physical education in our schools, we know that improving exercise is only one half of the equation. Providing more nutritious food for school children is also critical. In preparation for next year's reauthorization of our federal child nutrition programs, this committee has been looking closely at what we can do to help schools offer healthy, low-cost meals that children will want to eat, and I hope that today's hearing helps inform us on that effort. As a 2006 report by the U.S. Government Accountability Office concluded, the most important way to fight obesity is to increase physical exercise. But unfortunately, America's school children are less physically active than ever before. Children are spending more and more time of their free time watching TV, surfing the internet, and playing video games. The typical American child now spends almost 45 hours a week using media outside of the school. Just last week, the National Institutes of Health released a new study showing that kids are exercising far less intensely as they move into their teenage years. At the very time that kids are exercising less, schools are also cutting back on recess and physical education classes. Daily physical education classes, once routine in schools, are now offered by less than 10% of all the public schools. Although the National Association for Sport and Physical Activity recommends at least 150 minutes of exercise a week for elementary students and 225 minutes a week for middle and high school students, most students face a starkly different reality. A 2005 report of the National Center for Education Statistics shows that nationwide, public schools offer about 85 minutes of exercise for first graders and only about 98 minutes a week for sixth graders. This is disturbing on many levels. Multiple studies have shown that the regular physical activity has positive effects on student learning. Not only does consistent exercise help students succeed academically, but it also can strengthen their concentration levels and cognitive skills. Given these trends, it's extremely disappointing that the budget that we've been submitted to the Congress eliminates federal funding that would help expand physical education programs in schools. Schools are already being strained by skyrocketing food and energy prices and declining federal and state investments. Terminating this vital grant program takes an unfair toll on school children, especially low-income children who often have fewer opportunities to exercise outside of school. It goes without saying that the nation's child obesity crisis poses an enormous threat to our long-term health and economic strength.